All of the interventions from the family of products that we have in integrated listening system, all are based on neuroplasticity. We've been hearing a lot more of this in the last few years, thanks to Dr. Norman Doidge and 2 wonderful books that he's written. So what you're doing is you're helping the brain to recover through stimulation. This is how the brain grows, is how it repairs, is how it makes new connections through stimulation. We have a multi-sensory intervention for stimulating brain growth and brain recovery, with movement, with sound, with visual activities, with the bone conduction. All of this is very, very powerful for improving brain health and recovery. And you have a slide that shows you the neuroplasticity idea again, which is the brain's ability to heal and recover and make new neural connections in response to input or sensory input stimulation. So the brain can definitely recover. It's powerfully able to do that. I have a client I'm remembering from years ago in my practice that serves as a great example of the power of neuroplasticity in response to sound therapy intervention. This woman was 56 years old, a researcher, publisher, international traveler, lecturer, really an authority in her field. 4 years before I saw her, she had a whiplash injury. She did the usual therapies that were available at the time, mostly chiropractic, massage, some muscle relaxants, and other symptomatic medications to relieve some of her painful symptoms. When I saw her, it was 2 years after a second head injury. However, this was a whiplash. In both of these injuries, she never hit her head. She didn't hit her head on the side window or the front. She had stopped, she was hit from behind, and then hit the car in front. The head went just like this. So 4 years ago, first whiplash injury. 2 years before I saw her, a second whiplash injury. Having had a previous head injury will make you more susceptible not only to a second one, but to the consequences of a second head injury. The second head injury may be milder in the sense of the forces involved, but the consequences will be greater because of the predisposed vulnerability of the brain to injury. One of her greatest concerns about the therapy we were doing wasn't the therapy itself. It was the hour drive between Boulder and Denver that she would have to undertake to do the therapy because her energy was so low and she fatigued easily. Mind you, this is 2 years after her second injury. So we started, and within 5 sessions of the program that I had designed from the PRO program, she was already saying if it weren't for the energy I were getting from this program, I wouldn't be able to do the program. She had a lot more energy, more concentration, more ability to function. After her full program, she was able to stop and get off of all of her programs under medical supervision, gradually removing them, and she didn't need any of those medications again. Her energy had improved, attention, concentration, word processing, finding words, ultimately resulting in her ability to return to work. This is how powerful sound intervention with movement can be for recovering from any injury or many things, as you know, but particularly from a concussion and a traumatic brain injury. I have a concluding story, which is a little bit personal actually. After having trained many therapists on the approach to working with people with traumatic brain injury, particularly mild concussive type, I always emphasize, because I was asked, if this helped for major brain injury, penetrating injuries, or severe head injuries with actual damage to the brain. And I said, no, it doesn't appear that this is helpful. Well, fortunately, one therapist didn't listen to me, and she decided to go ahead with working with a man that she had who had a severe head injury, many complications physically, emotionally, cognitively. And actually this man made an amazing amount of recovery. He was able to do things that she and I didn't think would be possible, particularly in the cognitive area, but also he had a lot of coordination problems, balance problems, motor planning problems was a huge problem for him, and all of these got better. So take what I've shared with you with a grain of salt. If you see someone who you think you can help, don't hold back. This therapy is very safe, very effective, and we don't yet know the limits of what it can accomplish.